and click that button. All right. Thank you for joining us today. Our topic today is community approaches to strengthening families, and we're very excited about the speakers that are joining us and the information that will be shared. We just have an hour, so I'm going to jump right in, even though I know some people are still logging in as we go. But I wanted to welcome those of you who are new. I'll talk a little bit about these webinars since many of you were invited for the first time or are logging on for the first time. Then we'll go through some updates from the Center for the Study of Social Policy and from the National Alliance of Children's Trust and Prevention Funds. We have a network member joining us from California who wants to make a request for information from all of you. And then we will get into our topic for the day, which is community approaches to strengthening families. And I'm very excited that we'll be hearing from two of our network members about work that they're doing. And I'll also share some of our thoughts from CSSP about what that looks like. So just wanted to give a little bit of context since I was very excited to see a large number of people joined the webinar this month who haven't been on before. For the first time, we included that invitation in the Strengthening Families e-update newsletter, which goes out to a large list. Feel free to let others know about that. You can sign yourself up for the list on our website. Along the side of every page, there is a Stay Connected box where you can put your email address. That'll bring you to a screen where you can choose which of CSSP's newsletters you'd like to get. So from now on, each month, that newsletter will include an invitation to a webinar about a topic related to strengthening families implementation. And just wanted to be clear that these webinars are convened jointly by the Center for the Study of Social Policy, which is where I work, and that is the home of the Strengthening Families framework. And then by our national partner, the National Alliance of Children's Trust and Prevention Funds, who have been a tremendous partner in helping to get the Strengthening Families framework out into the world and help states figure out how to implement it. Each month we have a different topic with guest speakers who are doing that work or have interesting information to share. Sometimes it'll be more of a conversation, sometimes more of a presentation. It varies, but it's coordinated either by CSSP, the Center for the Study of Social Policy, or by the Alliance, or what we're starting next month is to have topics and guest speakers coordinated by a volunteer from the national network. So that'll be interesting as we go forward. We're going to have more and more of the peer leadership. And if you have a topic that you want to facilitate a webinar about, there will be opportunities to volunteer for that as well. So just a note that the recordings and materials from past webinars are posted on a site maintained by the Alliance. It has a long URL, but it's there on the screen, and you will see that in the next newsletter that goes out as well. It was actually in the newsletter that went out last week or the week before announcing this one. So you can see that link. It's a great archive with recordings and slides and accompanying materials from the topics we've covered in the past. So to say a little bit about our upcoming webinars, so you can mark your calendar if you're interested. We generally do these on the second Thursday of each month at 3 o'clock Eastern Time. Next month it'll actually be on June 4th, because on June 11th many of our key state partners will be at the CBCAP grantees meeting, so we didn't want to have a conflict there. So that will be held on the June 4th instead. And that topic will be about professional development strategies. So we'll be hearing from people at a state and city level about how they're coordinating efforts to get people trained in the Strengthening Families Protective Factors framework, some of the challenges and some of the strategies that have worked for them. On July 9th, we'll be hearing about building protective factors in correctional systems and with partners in corrections. August 13th, we'll be talking about some of the other work going on at the Center for the Study of Social Policy around young children and their families, which is all related to the protective factors. And on September 10th, we'll be talking about a protective factors approach to supporting foster and resource parents. And you'll see listed there are the volunteers from the network who are coordinating each of those, and we're very grateful to those volunteers.
Kaylin, I'm not sure, but I am not seeing your screen, so...
Oh, I am so sorry. Thank you, Martha, for pointing that out. I will show the slides that I was just talking through so carefully.
Thank you.
Thank you very much. So this is what I just said, but there's a link there if you missed it. And just some notes about those topics coming up and the dates. So go ahead and put those on your calendar now if you're interested in the topics. And you'll be getting the link with the registration details for each one as we go forward. The link for the June 4th webinar is actually there already. I don't believe you'll be able to click it on your screen, but if that will also go out in the newsletter that goes next week. Sorry about that. I'm a little flustered now. So this is me. I should have put my picture at the beginning. I'm Kaylin O'Connor from the Center for the Study of Social Policy. After sharing that intro welcoming information, I'm going to go into some updates from the Center for the Study of Social Policy. The first update is that part of the April activities for Child Abuse and Neglect Prevention Month, the Federal Children's Bureau put out a series of videos that they called Connections. And one of those videos is actually a Prezi, which is a type of moving presentation about the big ideas behind strengthening families and the protective factors. It features Nilofer Hassan, who was our initiative director for strengthening families for many years and who just left at the end of last month. So it's nice to have her voice on there as part of her legacy of strengthening families work. And we encourage you to view that, share it. I think if you're really familiar with strengthening families, you might still pick up some new insights, but it's definitely a great tool for sharing with others who you'd like to learn about it. You can get to that at the Prezi link that's listed there or from the About section of our website at strengtheningfamilies.net. Related to that, I wanted to make sure everyone knows that we have a bit of a cheat sheet now on our website. We redesigned the website last fall. It had been quite difficult to navigate before. I think it's easier to navigate now, but it is still very dense. There's a lot of material there. So we decided to give a little overview. So on the website itself, you can find an overview that says what's in each section. Our materials are basically divided up into about, practice, systems, and policy. So if you go to the website to that link right there, or just go to strengtheningfamilies.net and click under About, and you'll see this overview of the Strengthening Families website as one of the choices. Nice way to just orient yourself to what's there, to have a sense of where to look for something particular that you're interested in. And as always, there's of course a search box, and you can always email for specific information. I'm seeing some notes that some people were losing sound. I apologize for that. If you can type into the box if you are experiencing sound difficulties, type that into the chat box so we can kind of keep an eye on it. I'm not sure. So far, it's just one person has said that. So it could be a problem on your end there. We'll keep an eye on that. I'm sorry about that. Hope we can keep this running smoothly. The next update that I wanted to share is that we have some new materials available that we're calling Protective Factors Action Sheets. So what you see on the screen now are the Protective Factors research briefs that have been out for a couple years now, actually, summarizing why each protective factor matters and what it looks like. And a little bit about the research that tells us that this is a protective factor that matters for healthy child development and for prevention of child abuse and neglect. What we have added now is on the back of each of those, it's a PDF you can download that has all of the protective factors, and on the back of each research brief is what we're calling the action sheet. So it describes your role as a professional working with parents, what you can do related to this protective factor, some questions to ask, what to look for in a family, and then a couple activities that you could try to do with a parent. So people are finding those really useful. It's just really concrete information you can put into use right away. It's a nice thing to use in trainings. It's a good takeaway handout if you're talking about strengthening families somewhere. So go to our website. Those are right now, they're on our front page at strengtheningfamilies.net. You can also find them under About Strengthening Families. I'm going to check in on these comments. And it sounds like Kamiki, I think you might be the one who's having trouble, and I'm sorry that you're having a hard time understanding. If you're on the phone, you might want to try connecting just through your computer instead and switching to mic and speakers, or if you're on the computer, you might want to try dialing in. I apologize for that confusion. Okay, one final update I wanted to share from CSSP is that the Institute of Medicine, which is part of the National Academies of Science, part of the National Academies, has a new committee on supporting parents of young children. They just started meeting earlier this year. They're holding an open meeting in Irvine, California on June 29th. You can attend that in person if you're in that area, or you can register for the webcast of it. We encourage people to do that. We're really hoping that this committee made up of researchers will hear from people like you who have direct experience supporting parents, to hear about those experiences and to get your insights on what parents need. So if you're interested in actually testifying in front of this committee, they're doing that by lottery. So you can, if you go in person, you put your name on a list and you may be selected to give up to 3 minutes of comments. So it's not a large window of opportunity, but I would strongly encourage any of you who are in that area to consider doing that, or find out who might be doing that and work together on what those comments would be. Let me know if you have questions about it, and I hope a lot of us will at least be able to listen and find out what this committee is hearing, and hope they'll come out with some good recommendations. Okay, I'm going to hand over to Martha Reeder, my colleague at the National Alliance of Children's Trust and Prevention Funds, for her updates.
Thank you, Kaylin. I just want to share with you that as I go down through the list of attendees on the call today, I see many very familiar names, and I can see your faces, and I know that many of you have worked with us at the Alliance in various capacities, and I wanted to share with you, in case you didn't know already, and you can go to the next slide if you like, that on the 14th of April we lost a very fine colleague and very highly respected professional in our profession, Karen Kaplan. She had been working with us at the Alliance for the last several years on something that was her passion, which was the prevention of child neglect. And she lost her battle with cancer on the 14th of April. And I wanted to share that information with each of you because I know that you would want to know that if you didn't already. Karen asked us to make donations to two of her favorite charities, if you want to do so in her name, and then a book of remembrances from Karen's colleagues was shared. And if there are those of you who didn't get to add to that, if you would like to share something, please go ahead and send it to me at martha.reeder@ctfalliance.org, and we can share those remembrances with her husband, Richard Seidel. And the book was pretty inspirational to see how many people's lives that she has touched and all the work that she did in her too short lifetime. So Karen has had a great impact on our field. Can we go to the next slide? Some of the things that she really worked hard on with us at the Alliance, we are able to share with you on our website. She conducted key informant interviews with lots of people in our prevention field, both professionals, practitioners, and so there is a great deal of wisdom in those interviews. Created fact sheets that make it easy for you to share information about this very complex topic, and 3 infographics that I shared with you on our call last month. If you haven't seen them, I encourage you to take a really close look at them. She also created 2 PowerPoint presentations, a sort of a short version and a longer version that you can steal from and use in any kind of presentation that you have, with a lot of the information about preventing child neglect. And you will be glad to know that there, as an overlay to all of this, are the protective factor framework, and showed how that integrates with the work that needs to be done to prevent child abuse and specifically neglect. And so there are many rich materials at this site, and we will be continuing this work and adding to it as time goes along, and also hope to be able to present this information to you in one of these webinars later on this year. So if you can go to the next slide.
Sorry, I'll get there just a second. I had to click. There we go.
Okay. Our training team for our training of trainers just returned from the state of Arizona, and we had a wonderful time there last week with an amazing group of home visitors and people from local child abuse prevention councils. And we also had a few folks not from the state of Arizona, but a couple from Utah and a trainer from the state of New Hampshire. And so it was an incredible 3 days with that group of trainers, and I'm looking forward to all that's going to come from that group. And we have another training in Atlanta the 3rd through the 5th of June, and the original deadline was May 8th, and we've extended that through next Monday. If we have passed the hotel deadline for the group hotel rate, but if you are interested in participating in the Atlanta training, we still have a few hotel rooms that we saved at the group rate, and we have reserved. And so if you want to make those arrangements, you probably need to contact me directly, and we'll just see and how long those that will hold out, and how many rooms we will have. But we still have a few at the group rate. The registration is on our website, and it should be very easy to get registered for the training. We're looking forward to it. We will have a group of people from across the country, so it'll be a very mixed group. It'll be a very rich time of sharing and training, and I hope that you will be able to join us if you're interested. Then we have some other dates coming up. We will be in New Jersey the 29th of June through the 1st of July, and there will be a very few training slots left over from that New Jersey folks will not be using, and so we would like to offer those to you on a first-come, first-served basis. We will not put the registration up on our website, but if you are interested, you need to contact me directly, and I will be able to we'll just give those to those who contact us, and on a first-come basis. And we will be in Trenton, and it'll be an amazing group of trainers there in New Jersey. They've already trained one group, and they're in the process of training another. So it'll be a mix of child welfare practitioners and child care practitioners. So it should be a very interesting time together. That's all the information, or all the sharing that I have for you today, and I'm looking forward to hearing all the others on the call that are sharing today.
Thank you, Martha, and thanks for that beautiful tribute to Karen. Such a sad loss, but we're happy to see that people were able to come together and share their great memories, and hope others on the line will appreciate getting to look at those as well.
Thank you.
I want to transition to asking Troy Nichols from California to speak up for a moment. He had emailed me asking who he might want to talk to about this, and I said, why don't you talk to the whole network? So Troy, are you there?
Definitely. Thank you, Kaylin.
Thanks, Troy. You sound good.
No problem. Good afternoon. I am with an organization called Strategies, which is based in California and is funded by the Office of Child Abuse Prevention. We provide technical assistance, capacity building, and training for agencies that work with children and families at risk in the state of California. One of my jobs as the project specialist is I'm also the state lead for the Strengthening Families framework. One of our other responsibilities in our scope of work is to host what we call the Strengthening Families Roundtable Learning Community. This provides information in various areas about implementation and usage of the framework. As a part of the roundtable, there are 3 work groups. One is the data and evaluation work group, one is the policy work group, and the final one is the communication work group. And each are tasked with addressing topics in their respective areas. They're also, as a task, asked to develop the presentations that we give for the roundtable, which are usually a 2-hour presentation that we either bring someone in or we collect information to develop a presentation. And that's kind of what has brought me here today. On June 4th, we have our roundtable, and the communication work group is tasked with that presentation. And they've begun to develop a very good presentation about how Strengthening Families has been communicated throughout the state. And we also want to look for ways that it's been communicated nationally. When I say communicated, we're talking about the various and creative ways that we've seen, whether it be at conferences or just through our own networking, of ways that we have gotten this information out to various groups, whether it be to parent partners, agency leadership, how it's been shared with networks. One of the important areas that we're kind of lacking in is how it's been shared with policymakers. Those that are in power that develop legislation for our youth at risk and our families at risk, and how that Strengthening Families framework has been provided to them. So what we're looking for now is just information on the national level about how networks or agencies have done this communication process. We're looking for communication plan, marketing plans, because we want to share with our group and our network not only what's going on within our state, but what's been going on nationally to provide this information that we all know is such an important effort to limit child abuse and neglect. So that's my request. As you can see, my information and email is on the screen. And if anyone would like to have a dialogue, it is kind of time sensitive. So again, we're just looking for information that we could share. And I am very open to having a dialogue about that, as well as sharing things that are going on here in California.
All right. Thank you so much, Troy. And I just put your email address into the chat box in case anyone just wants to be able to copy it, paste it into an email. I would love to be copied on those emails as well to find out what people have to share, and hope that you'll get some good information. So thank you
so much, Ken.
And let that also be a reminder to all of you, if you ever have a request like that you'd like to get out to the network, please let me know, and we'll be happy to give you a couple minutes on the webinar or some space in the e-update to share a request or some information. Thank you. Okay, so the topic that we're focusing most of our time on today for the rest of the hour is community approaches to strengthening families. So I'm going to talk a little bit about what we mean by that, and then I'm very excited that we're joined by some people who can share some really good examples of how that's looking in their communities, or some strategies that they're using to get it out into communities. So when we talk about community approaches, what I mean is how we can look at strengthening families distinct from the small but significant changes that we usually talk about that individual programs or practitioners can make, or even that systems can make in how they work with families, but more about what entire communities can do coming together. So that's what we would consider a place-based initiative, or a community level initiative, where you might have a cross-systems team. You might have everyone coming together in a neighborhood to interact in certain ways, and change some things about how their neighborhood is working together, change some things about how services are provided. But the difference here is that it's not necessarily policy or system driven. It might be driven by parents, it might be driven by a teacher, by a community organization, but someone who's bringing others together to engage partners who might not typically be prevention partners. They might not typically even consider themselves a service provider, but other entities in the community who do have a role in children's and families' lives. So these are basically innovative ways to reach families where they already are, where they spend their time, where they have trusting relationships. And I think that has been one of the key elements in why Strengthening Families has been successful. Is the whole initiative was originally built on reaching families through early care and education, a system where they already spent their time, and using a lot of what we already knew from family support to help other professionals provide similar types of support in other settings, and then of course to link to family support and to other forms of more intensive services as needed. But what we're looking at today and what we've been talking about as a new area, not necessarily new, but an area of new focus for us at CSSP is looking at how communities are doing this and how they can. So we've used this, what we call the daisy or a star or whatever you'd like to call it, this image of all the different systems that touch the lives of children. We've used that for a long time in talking about who needs to be around the table when we're implementing Strengthening Families in a state or in a community. But what we also recognize is that that daisy is just one piece of a larger picture of where families actually live. And so families actually live in communities. They are interacting with other families, they're interacting with businesses, with medical providers, with faith-based organizations. They're living their lives in communities. Their lives are touched by the systems that we all work in to various degrees. Some families may have very little contact with formal systems, some have a lot more, but regardless of that, we know that they're living their lives in communities, and that if we really want to make a difference for children and families, we need to be looking at all those places that they spend their time. So if you've been hanging out with CSSP for a while, you know we like to come up with these schemes and frameworks and ways of categorizing things. So this is how we've started looking at the different ways that Strengthening Families is being implemented at a community level. This is far from final, but so it's a way to start thinking about it. We're happy to get any input on it as well. So one way is by engaging individual actors. That's what's listed at the top here. That sometimes we know there are individuals who are doing things that help to strengthen families. There are individuals who find out about this framework and run around telling everybody about it. There are people taking everyday actions to support the families around them. Then we have community institutions. And here we mean not service providers, but other institutions, the churches, the synagogues, the schools, the businesses, the parks, that are in a position to build protective factors through various community activities and through various ways that they interact with families. So we know that some of the small but significant changes that we've been talking about with Strengthening Families for service providers can also be put into place in community institutions that don't see themselves in that role typically. But also that sometimes it might just be that helping some of these community institutions to see their role differently, start to think about the protective factors of the families they work with, and try to align their services with that, and also help them connect to the other community entities that are helping families in those protective factors. And finally, at the bottom, we list the service programs. And here, when we talk about community level implementation, we're talking about how service programs are connecting to each other. So this has always been critical to Strengthening Families implementation, but we do see in some places, some neighborhoods and communities that are really taking this to a new level of how well they're collaborating across different service providers, how they're integrating protective factors into assessment and collective impact efforts, and the kinds of changes they're making in their service structure to build protective factors. I see a question has popped up. I'm going to make sure that it's not urgent. Someone did type the audio had gone. If that's also happening for you, please type in and let me know, because of course you can't hear me if it is. I think someone else would have let me know by now if the audio had fallen out. I think one person may have lost their connection. Okay, so I'm going to give a couple examples to illustrate what we mean by these levels, and then we'll get into specific examples from our guest speakers. So one case example that we like to talk about is in Charlevoix, Michigan. This is a way of engaging individual actors where the Great Start Collaborative wanted to work on strengthening families, but they wanted to make it something that everyone in the community was talking about. So they developed a set of posters, which I'll show in a minute. They developed a website about individual actions you could take. They set up a free cycle campaign using the website Free Cycle, where people can post things that they have available or things that they need and just get people trading resources in the community. But they did that with a particular focus on families and thinking of it as a concrete support in times of need and a way to maybe build some social connections. So they really did it as a public education campaign. And the posters that they created are beautiful. The words on them to represent each protective factor were developed by parents in the community, as were the images used to illustrate them. We've talked about these on a couple past webinars. The Great Start Collaborative there is happy to share their posters. If you can pay for the cost of having the graphic designer put in your logo in addition to theirs. They've done some translated versions of these into Spanish and Mandarin Chinese, and they're just great to work with. So if you want to use these posters, you're welcome to, or if you want to do something similar in your community to have parents come together and come up with how they would want to represent each protective factor and get some posters up, it's a great idea. Another level of individual action is what we call connect the dots. And we just did a webinar about this in February, so I'm not going to spend too much time on it, but I'd encourage you to check out the website whatsyourdot.org. One large piece of this is talking about what individuals can do in their communities, which is called having a dot, that everybody has a dot, we all have a role to play, and when you connect those dots, you can have a much stronger net of what's supporting families and making communities places where children and families can thrive. And connect the dots involves both individual actions and community engagement and moving up into policy advocacy. So it covers more than just just the individual actions, but I think it is a good example of taking protective factors content and talking about what individuals can do in their daily lives to promote them. Moving into the community institutions level, one case example is from Leelanau, Michigan. We're really hitting northern Michigan hard today. Charlevoix and Leelanau are not that far from each other. But this was actually one of our first exemplary programs for strengthening families. This was a child care center that, while it was small and serving a small community, it was playing a really vital role in connecting parents to resources in the community. One thing they had going on was a partnership with the laundromat and the pizza parlor, so that one night a month there would be a free laundry and pizza night. What families were invited to it. The child care center would provide child care, and the parents would receive some parenting information and have an opportunity to connect with each other while they got their laundry done. Great event for it could be considered an advertising or marketing expense for the laundromat and the pizza parlor. They're building future customers by providing this free service, but they're also helping to meet a lot of family needs and bring people together in a unique way. So that's an example of really building protective factors in places where families already go and engaging some partners that wouldn't necessarily consider themselves to have that role right away. And then I wanted to give an example about service programs coming together. And this is from a neighborhood in LA called Magnolia Place. I should just say there is a lot of strengthening families work going on in Los Angeles. It's very exciting. I think we'll actually do a whole webinar just about that relatively soon. And so I'm giving a very small example from one of their neighborhoods that's representative of some of the work that's going on there. So this is a very densely populated area in LA, and all the service providers came together within that area, which to tell you how densely populated it is, there are 75 service providers in this neighborhood. about a 5-square-mile neighborhood. And they came together to say, what would it take to really have unprecedented success for the children living in that area in terms of education and health and the nurturing care and economic stability they could receive. They used the Strengthening Families Protective Factors as their guiding framework. And they did some really interesting things, including some surveys. They had an agreement among all the service providers to use a very brief survey. And just to survey, I think each provider surveys about 10 people a month. So it's really, these little snapshot surveys, but across all the providers, that gives you 750 or 800 surveys completed every month. So they are able to monitor some of these indicators of family well-being that they decided on. And they also are monitoring, some of the questions are things like, did anyone ask you about your social connections? So make sort of a checking in on how well the each provider is making families aware of these protective factors and checking in on them. There's a few other things they're doing here. I'm going to show, it's just a graphic. We can't see the details on it here, but they have a community dashboard that shows what the trends are in those questions that they ask in the brief survey, so that they as a community then can come together. It's not a level of data that's going to have one program make huge sweeping changes based on the 10 people who responded to their survey, but as a community they can say, oh, hey, we need to do better in this area, or we've slipped up here, or we're doing better here, celebrate successes and find places that they can work together to make some improvements. So I want to talk briefly about some of what we would consider the building blocks of these efforts. I think generally, while we could see an individual pizza parlor or laundromat start to offer the kinds of services we're talking about, I think generally these things are going to come about through a leadership team that's coordinating the effort, that might not include all the usual partners, but some sort of team coming together. And then having some kind of structure for mutual accountability. So saying, this is what we're working toward, we're going to check in whatever way makes sense for the work that we're doing, but check in regularly on how well we're supporting families with these protective factors, come up with some shared indicators of what that's going to look like. Another building block would be shared training around the protective factors. I think we've all seen the power of shared training, getting people together, having some messaging and communication tools, and then using parent-to-parent approaches. So we listed their cafes. We don't have time today to go into what cafes are really all about. I hope many of you are already familiar with parent cafes or community cafes, or both, or the new parent-provider cafes from 0 to 3. It's a great model that a lot of people are using. Please go to that link and learn more about it if you aren't already familiar. I want to keep moving so we have time for our speakers to share their examples. So I'm skipping a little bit over the cafe part. Wanted to say one last thing, which is that the family support system is really what we're picturing here, that all these other places that families go, whether it be a business, a grocery store, a doctor's office, a school, wherever they're going, we want them to have we want the professionals there and the people they interact with to have some sense of family support, that part of their role is to help families be strong. But we also want them to do that in the context of knowing that they can make a referral to services if a family needs something that they can't provide. So we're not saying that you don't need the professionals that are parenting educators and home visitors and family resource centers and child welfare and substance abuse services and all of that. All of those are very important. But when we have a sort of light touch model out in the community, parents can much more easily get connected into those other services when they need them. And the professionals they interact with in other settings can feel more comfortable sort of inquiring about how they're doing, knowing that they can make a referral if they need to. And then programs like Help Me Grow provide kind of navigation support to help make those connections. So we envision this family support system that includes a lot of community partners getting engaged in the kinds of ways I've described, knowing that they can refer back to a backbone of more intensive services. Now, having said all that, I want to share some examples from the network. I did mention that in February we had a webinar about Connect the Dots. In April we had a webinar about Safe Families for Children, which is another, it's a volunteer-based model working out of faith-based settings, but using the protective factors framework as part of how they do their work. I'd encourage you to look up either of those initiatives or to find the recording of the webinar on the website I posted earlier, and just check those out. Today we're going to hear about two great examples. The first is about some recent community mini grants that were given or have just been given in West Virginia, and then we're going to hear about strengthening families churches in New Jersey and beyond. So without much further ado, I will introduce Jeanette Rousey from Strengthening Families West Virginia so she can share about what they're doing there.
Thank you very much. Welcome and hello from West Virginia. As Kaylin mentioned, we have just awarded some community mini grants in West Virginia, and these were through the Team for West Virginia Children with support from our State Office of Maternal, Child, and Family Health, and some combined federal grant sources as part of a kind of a larger umbrella of a lot of things that are going on in our state right now. And so what we did is we took a pot of $25,000 from that funding, and we are granting $5,000 to 5 different projects around the state to intentionally broaden, deepen, and or sustain community-level strategies to improve family well-being and healthy child development using the protective factors framework. And this is a very short grant term. It just goes from May through September of this year. And we wanted to support some innovative local projects with this to engage new partners and, as you know, going along with Kaylin was talking about, take a community or place-based approach to building these protective factors among families of young children. And really we wanted to look at promoting cross-sector implementation and working toward a common purpose that strengthens the presence of the protective factors in all families. So with that, we received 16 proposals and funded 5 of them. And just, you know, this is actually the first public announcement, if you will, of the grantees that were funded. And they were all selected by our review team. The ones that were funded were selected as the strongest proposals by each person on the team. And the strengths of these proposals were that they were based on community needs assessment. They showed a already pre-existing level of really strong community collaboration. And in West Virginia, I think we find that in a lot of our communities that we may be poor on resources, but we're very rich on working together and collaborating among different kinds of agencies and service providers in different sectors. So we saw that. We saw parent involvement in the planning of these proposals, a diverse group of committed partners in the community, and the funded projects were all really well grounded in the protective factor framework, and we have done some training over the past several years to kind of build that knowledge. So that being said, we had a really nice diversity of projects, and I'm going to briefly describe each one. The first one, and as you can see by the little flowers, our little West Virginia Strengthening Families logo symbol, right in the middle of the state is Gilmer County, and their project is called Fireside Connection. And Gilmer is very rural. Their population is only 8,700 some people. And in response to a community needs assessment, it showed that there was a real need not only for parent education and support, but there was a real desire for community gatherings and family and youth activities. So like several of the other grants, this project is kind of based on summer family activities and, you know, providing a place for people to go and fun things for them to do. So what they're going to be doing is a weekly series of family bonfire events on the grounds of a local church. And they're going to feature the first hour kind of doing some fun activities with the children through a Healthy Alternatives for Little Ones curriculum, while the parents take part in some facilitated discussion around specific protective factors and parenting topics. And then the second hour will be a time of kind of parent network, family activities, and a hot dog roast. So a big group of community partners are there to offer information and answer questions and provide resource information for these families. The second one, statewide Strengthening Families Parent Cafes. Again, this is a concept that's making its way into our state as well. The State Healthy Kids and Families Coalition is a large statewide grassroots group, has typically been focused on a lot of policy work, but there's 177 partners of West Virginians from every background and socioeconomic sector. And their intent this year with the mini grant is to host at least 10 parent cafes in the northern part of West Virginia, and then following that up by training parents and community leaders in promoting protective factors locally. So I have the smaller little symbols up there in the northern panhandle of the state showing some of the areas where there's already been organizational willingness to host the cafes. And then on top of that, the coalition is sponsoring their child abuse prevention consultant to become certified through the National Alliance Training of Trainers in Atlanta to support and sustain that initiative in the north, pretty much the whole northern part of West Virginia. The third one, again, it's kind of another takeoff on summer activities, but the United Way of Southern West Virginia in Raleigh and Fayette County, the two adjoining counties in the southern part of the state, they are partnering with the maternal infant health outreach workers, the MyHow program, along with the county farmers markets, the extension service, and the local libraries to introduce these young families to farmers markets, encourage healthy eating, provide children's books, encourage reading, and to become stronger in the protective factors. And it's another great thing about this grant is that MyHow's target population is generally young families of young children who are economically disadvantaged as well as geographically or socially isolated. So this project is going to help these families become more connected to their communities as well as the great resources available through their libraries and the farmers markets in terms of the health and literacy of their children. The fourth one is in Barber County in the northeast part of the state, and it's called Stable Families and Literate Little Ones. The county school system has entered into formal agreements with a dozen community partners to facilitate a series of summer events to support and educate new and young parents of preschool-aged children. And again, this is a very rural county. They were going to do a series of sessions in some convenient, centrally located sites and emphasize a fun, casual, and low-stress atmosphere. Each session will take a two-generation approach, working both with parents and children on activities that are specifically tailored to a key protective factor with a dose of early child literacy activities built into every event. And then the final one, number 5, is Bloom Where You Are Planted by the Cabell County Family Resource Network on the western edge of the state, where I'm talking from. And this is one of West Virginia's most urban counties, and we're also a regional medical hub that is increasingly treating drug-exposed infants and their families from a large geographic area. So one of the key goals of this project will be to engage with the medical community to provide protective factor and trauma information to medical students and supportive service providers, as well as to link parents of vulnerable infants to direct support and information. And then the project is also going to look to engage one business in assessing their human resource practices through a strengthening families lens and integrating protective factors into the workplace. So some nice innovative activities going on there as well. So those are our 5 funded grants, and we're really excited about it. Again, we've just getting the ball rolling on those. But I think our expectation for this is that the leadership team members, and this was part of the requirement, is that they commit to participate in either live training around West Virginia or the online protective factors training that's available. And then our team is going to offer some targeted technical assistance with the goal that not only the families are going to learn about protective factors, but that the community partners will become learners as well, and that we can help ground them in the strengthening families approach. So at the end of this project, we're hoping to kind of form a mini learning community and learn together and share lessons for future place-based work in the state. So that's what we're doing.
All right.
And, thank you for your attention.
Thank you so much, Jeanette. I'm excited about what you're doing there, and excited to see those activities get carried out. We are running a little bit short on time. I'm going to welcome our next speaker. Daryl, I just unmuted you. Reverend Daryl Armstrong is joining us from Shiloh Baptist Church in Trenton, New Jersey. And we are scheduled to wrap up in 10 minutes, but I think Daryl has a little more than 10 minutes to share with us. So those of you who are able to stay on a little bit longer, perhaps we'll let Daryl keep going. Hate to cut this short. So we understand if you need to get off right at 4 o'clock Eastern, but if you're able to stay on, please do. And I'm going to switch over to Daryl's additional slides. And Daryl, are you there?
I am. Can you hear me?
Yes, you sound great.
Great. So good afternoon, everyone. I want to thank Kaylin and Martha and all the good folk at CSSP who I love and adore and appreciate greatly. Kaylin started off with a couple of key statements about the origins of the protective factors and really being where people spend their time and where people have trusting relationships. You know, I like to say whenever I make these presentations that we want to make families stronger where they live, where they work, where they play, and I often like to add where they pray. And so, you know, how do the protective factors relate to communities of faith is something that I've taken great interest in as a ordained Baptist clergyman. I've been pastoring my local congregation for the last 15 years and have been really privileged to be in partnership with folk like Judy Meltzer and Judy Langford and Kaylin and a number of other good folk. So what I want to talk about is how do we use kind of mainline denominational structures to actually promote the protective factors as well as embed them into community programming in houses of worship. So I want to be careful not to say just churches and really be clear about houses of worship and inclusive of synagogues and temples and mosques and other institutions where people do indeed develop their faith tradition. One of the things that a number of us have done here in New Jersey is, and Kayla, I'm going to ask you to skip down to the slides that say National Movement with the Pinwheels for Prevention and CSSP logo on it. Yep, is to not only work with our national partners such as CSSP and Prevent Child Abuse America and Children's Defense Fund, the next slide, the Children's Defense Fund, the CWLA, all of our macro kind of bigger child-serving organizations in the country. You can go to the next slide as well, Kaylin. But we've also, and if you skip the next two slides, Kaylin, we've also tried to partner, and when I say we, I'm talking particularly about not only a group of congregations here in New Jersey, but also a number of faith partners around the country to try to identify partners with, one more slide over, the National Baptist Convention, the American Baptist Convention, both of which have thousands of churches around the country. The next slide, working with the Episcopal Bishop here in New Jersey and to work with the two Episcopal bishops here in New Jersey, I should say, and work with bishops around the country. And to try to also expand and include international faith organizations like the World Council of Churches, Baptist World Alliance, and clearly our Catholic communities and archdioceses around the country and around the world. One of the things that we've tried to do is take the protective factors and make the argument that language matters. So if you go to the next two slides over, Kaylin, You'll get to, yep, and one more over, I'm sorry. You'll get to what many in around the state of New Jersey have included in our prevention plan. And so these protective factors, the first 5 of which are often the ones cited by CSSP, and then we added, when we were developing a statewide prevention plan, added many other, or a few others I should say, to round out how we engage. One of the things we did when we did that back in 2006, 2009, we developed this prevention plan for the state of New Jersey, was to say that language matters when you're talking to faith leaders. And so the next slide is how we would traditionally relate these 5 protective factors without using language that probably is embedded and familiar with our faith leaders. And so I often use this slide and then the next slide superimpose language from one's faith tradition to say, not only do we do social connections every Friday and Saturday and Sunday as a general part of what we do as faith leaders, bringing people together, dozens of families, hundreds of families, but really then using the language of their religious book to try to facilitate a conversation. So we may not call it social connections, we may call it simply congregational gatherings. We may not call social concrete supports in time of need in faith institutions, but we may use the term benevolence. We may not talk about knowledge of parenting and child development, but we talk about baby blessings and christenings. And so one of the things that we often say is that language matters. And so trying to interpret and reinterpret the protective factors in a Judeo-Christian framework, in a Hindu framework, in a Buddhist framework, in a Muslim framework, using the Quran or using the Gospels or using the Torah or using the Vedic scriptures for Hindu brothers and sisters, or using the Ling scriptures for our Buddhist brothers and sisters. We've tried to take the language of their holy book or books and say what is it in their holy books are commensurate and reflective of the protective factors and vice versa. And so that's been helpful, because if you get into someone else's shoes and try to speak their language, then perhaps the message is better received. So again, this is theoretical. I could spend a lot more time on that. Kaylin, if you go over 4 more slides. One of the things that we've tried to do here in New Jersey to make this more relevant, one more over for me, Kaylin, is to create what we call a Strengthening Families Covenant. And this Strengthening Families Covenant was an attempt to say, can we get a document that asks clergy of varying faiths to sign on to do certain things? The next slide blows the covenant up a little bit. And so, I'm sorry, go back one more, Kayla, I'm sorry. So this, what you see on this slide is the attempt to ask the pastor, the priest, the sheikh, the imam to do 5 or 6 things. Number 1, that they would focus on children in their congregation, focus on families in their congregation, focus on men in their congregations, women in their congregations, and baby blessings. Every house of worship, regardless of the tradition, in my estimation, has some ministry or outreach to young people, some ministry or outreach to women, to men, to marriage, to couples, and then they do some kind of baby blessing. And so then we asked the clergy to take these outreaches to these constituencies and use them as windows to promote the protective factors. So number 2, for example, talks about the notion of changing our houses of worship's children and youth ministry to be congruent with positive youth development principles, practices, and programs. Now, this is very high order, so what does that mean? And so part of what we would then go into after they sign the covenant is sitting down with their leaders and doing trainings on what are the protective factors, what do you do in your house of worship, and how do these protective factors really crosswalk with what you're doing. One great example of this is the baby blessing. And so if you go down to number 6 on this covenant, number 6 says, changing our house of worship's baby blessing and christening rituals to be commensurate with positive infant mental health principles, practices, programs, and partnering with evidence-based early childhood and home visiting programs such as HFA, PAT, NFP, all the evidence-based programs that are out there for early engagement. Practically, what does that mean? So literally, we've asked faith leaders to not do these rituals until they sit down with the expectant parents and or expecting caregivers, because we know it may not always be mom and dad, and they talk to them using handouts about baby brain development and neuroscience, but not using obviously that those technical languages, and really just simply convey to them that this is an opportunity before we bless or christen or dedicate your child. This is an opportunity for us to do some training with you as if we were doing premarital counseling or as if we were doing any other training for any other kind of license. We have to do driver's tests to get his driver's license. We have to go through, hopefully, some kind of premarital counseling before one gets married. We want to give some kind of training to parents in their house of worship before they get their baby dedicated or christened. And so we've asked houses of worship in New Jersey to sign on to this. We have 250 churches, I should say, in what we call our General Baptist Convention of New Jersey. The convention itself voted to essentially adopt the protective factors and make our houses of worship strengthening family sites, which essentially would mean taking these 5 protective factors and using this covenant as a vehicle to get entree into training around the protective factors. So what I'm doing now, and a number of us, are simply getting every pastor within the convention to sign on a covenant and then get those covenants and begin to do trainings in geographic regional areas. We are in the middle of getting all the covenants signed right now. We have not started the trainings, and that will be the next phase after we do this. Being the grand optimist that I am, I believe that once the General Baptist Convention really begins to embed this within our house of worship, that we will begin to then use this as a framework and model to take to other state conventions in Pennsylvania, in Delaware, in New York, and hopefully one day have the National Baptist Convention, which has 10,000+ churches around the country, to say that all of our houses of worship are strengthening family sites. But before we can consume that elephant, we simply want to take one bite, and the first bite is to get 250 pastors in New Jersey to sign this document and begin to work with other faith leaders from other traditions as well. So listen, I'm going to stop there. There's much more I could say, a few more things we could show, but I think this will suffice to give you a sense of what we're trying to do here in the state of New Jersey through one faith tradition, that being the General Baptist Convention of the state of New Jersey. So, Kaylin, I'll stop there, and thank you very much for the time.
Oh, thank you so much, Daryl. I think you shared some great information, just a snapshot of what you're doing, and your vision is really exciting, as always, to think about how this could go national. I think there are probably a lot of people who just heard that around the country and said, I'm taking that to my pastor, I'm taking that to my rabbi or to my place of worship and seeing if we can do this. So I think that's really exciting. And I do appreciate you taking the time to join us. I know you have a very busy schedule. So I apologize that we went a little bit over time, but actually just about 5 minutes, and almost everybody was able to stick with us, which I really appreciate. A testament to the level of interest in what we're talking about here. So thank you, everyone, for joining us. For those of you who it was your first time, I apologize for some of these technical difficulties. It might be part of just having a larger group with us a few more issues with sound and audio quality, but I hope that everyone was able to follow along and that you'll join us again. Please feel free to contact us. I put Maya and Martha's emails there. If you want to get in touch with Daryl or Jeanette, let us know and we can connect you. So thanks once again for joining us. I hope you'll join us again and be in touch and keep doing your good work. Thanks a lot, everyone.